Okay, so I'm gonna be today's moderator. I'm David Levine, along with Philip Genschel. I'm one of the organizers of this workshop. This is where we're going to try to go out with a bang. This is our last workshop of the year, and I think we have a pretty interesting topic, which is COVID-19. And we have two very good speakers. Andrea Ichino is an economist who's been doing a lot of work recently on COVID-19, particularly in Europe and Italy, but just more generally as well. Vivien Schmidt is a political scientist. She is focused, although she teaches at BU in the United States, she has particular interest in European institutions. She has a forthcoming book about legitimacy in the Eurozone crisis, but she's going to talk today about legitimacy and COVID-19 crisis, I believe. So the format, so you'll know what we're going to do. Andrea will go first. He'll speak for roughly 20 minutes. We're not going to stop for questions at the end of Andrea's talk. We're going to go straight to Vivien. She will talk for about 20 minutes. After the 40 minutes are done, we will then go to you guys. We'll open for questions and hope we have some good discussion about both the specific issues raised by the speakers and other interesting issues about COVID-19. So with that preamble, Andrea, the floor is yours.
So thanks a lot for this opportunity to present this work with Carlo Favero at Bocconi and Aldo Rustichini at the University of Minnesota. This work is, of course, motivated by COVID, but in particular by two observations. The first one is about two regions of Italy in the north, Lombardia and Veneto, side by side, usually among the most advanced regions economically in Italy, who experience dramatically different consequences of the pandemic. Lombardia, that has twice as much the population of Veneto, had more than five times the fatalities observed in Veneto, with a very large peak around March 30. Veneto was also hit severely. It was actually one of the first regions to be hit severely, but in a much less severe way with respect to Lombardia. And these differences, we see them throughout the world. We see areas hit very harshly and areas that have been spared by the pandemic. And I think this is a question that will be studied for a long time, because so far we do not have a good explanation of why the virus is so heterogeneous in its effects. We have an hypothesis for Lombardia and Veneto. This is work in progress, I should say. We are not completely happy now of the hypothesis as expressed now in the paper, and I will discuss this later. The second fact that I think motivates our analysis is, I think, the most important one, is that if you look at Italy, there have been about 30,000, more than 30,000 dead, 338, only about 300 have an age lower than 50. So this is perhaps not well understood by everybody, but this virus hit only people above 50. So the question is why we are not considering, all states are not considering age as an important factor in deciding which policies to implement to cope with the virus. So in fact, if we think about this fact that age is so important, it is obvious that it doesn't make any sense to have an indiscriminate lockdown. We are, in a very costly way, keeping at home kids that don't risk anything, and even young adults that don't risk anything. So it would make sense to differentiate working activity according to age. There is an organizational problem that we need to protect older persons like me, and we have to limit the interaction between all the workers or all the people, even if they are inactive, with respect to the young. But there is really no reason to prevent the young from doing whatever they want to do, because they are at a really low risk. So what we wanted to do in this paper is to see, well, is there any way to go beyond this intuition, this hypothesis, and measure whether coping with the virus in this way works? And if it does work, by how much it would help us coping with the virus? So to answer this question and see whether this is relevant, we have taken the epidemiological model that by now everybody knows, this SEIR model, a model of the spread of the COVID-19 virus, but we modified it in 3 ways. First, we incorporate in the model the fact that the risk depends heavily on age. Second, we also consider the fact that not all sectors have the same degree of proximity among workers. There are sectors that, like agriculture, in which the risk of contagion is very low, and sectors like health, in which the risk of contagion is very high, and education is actually among the risky sectors. I will finish my presentation with some slides about schools in Italy. So age and sector should be part of any simulation, and also, and this is instead the characteristic of our simulation on which we are less sure today, but the current presentation will highlight the possibility that there is an intensive care unit constraint. When intensive care units are supply is limited, this may increase the number of deaths. So another important aspect of our paper is that we're not only interested in simulating fatalities. We economists, we study trade-offs, and what we are interested in is to establish, to measure, to describe the trade-off between number of fatalities and GDP losses. And the main findings we have is that luckily there seems to exist policies, prudent policies of gradual return to work that may save many lives with limited economic cost up to a threshold. Beyond the threshold, either you get huge economic losses with limited gain in fatalities, or huge fatalities with limited gain in economic welfare and production. Specifically, these policies all involve the combination of age and risk and sectors to decide who are the people who should go back to work. Just to give you an idea of what is the output of our model, this is, for example, for Lombardy, the contour of the efficient policies that could be implemented in this region. For example, here, this brown square on the right is the hypothesis of the policy of continuing the lockdown for another year. This would have a tremendous GDP loss of 25% with a very low number of fatalities, but it's clearly not a feasible way or feasible strategy, because that would kill the economy and produce death for other reasons. So the green dots are policies that instead start to, from 20 to 1, to send in the market, into production, progressively more and more age brackets and more sectors, starting from those who are younger age brackets and less risky sectors. There are, of course, many policies in this area of the graph. These are inefficient. They are dominated by policies that can obtain both a lower GDP loss and a lower number of fatalities. This frontier describes the contour of the most efficient policies. And as you can, of course, there are many more here, but these are the ones that are feasible, that could be implemented. And as you can see, there is this sort of kink here that indicates that if you, from lock, you allow people to work, you can reduce the lockdown intensively without increasing fatalities up to a loss of 5%. Going beyond that loss would cause instead a tremendous increase in fatalities. Vice versa, if you want to start from all and reduce fatalities, you can do it up to this area, around 5,000 deaths in Lombardy. But if you want to reduce fatalities further, you just cause a big GDP loss. So this is the kind of output that we get in our model. So as I said, the innovative aspects, let me be a little bit more precise without entering into details about the innovative aspect of the model. So an important one is that, differently than in all the other models that you probably see around, the famous basic reproduction number R0 that described the spread of the virus. That is, this number R0 measures how many people an infectious person will infect. So if this number is 2 and I am infected, it means that during the period in which I'm infectious, I will infect 2 persons. Now, this number in our model becomes a matrix, actually a 19 by 19 matrix that has a different number, different R0 number for every type of interaction, and where the interactions depend on age brackets, sectors, and activity status of subjects. We focus on Lombardia and Veneto for the reason that I described, and we introduce these intensive care unit constraints. Specifically, we will work with 2 sectors that are defined as a high and low risk of infection, based on a paper by the Bank of Italy that allows us to characterize and measure the risk of infection in various sectors of the Italian economy, and we group them in 2 aggregates. And we have 9 age groups because in the well-known paper by the Imperial College, we get estimates of the biological parameters of the model differentiated by 9 age brackets. The policies that we study are characterized formally as activation vectors. So imagine that you have 5 age groups from 20 to 60 to 65 in the low risk sector, and 5 age groups in the high risk sector. This means 10 groups of people that can go back to work. A policy specifies which of these groups go back to work and in which proportion, in the sense that there may be a minimum number of workers in each of these groups that have to work anyway. The GDP loss that we measure is measured, and this is something we want to expand in the future, but for the moment we limit the calculation of the economic loss as a proportion of the fraction of workers that are not allowed to work depending on each policy. Of course, this is probably a lower bound of the macroeconomic cost of the interaction between COVID and policy, but for the moment, I think that this is informative enough. So just a brief characterization of the SEIR model with our modification. This is probably something that by now all of us know very well, but this epidemiological model is a model in which there is a population of susceptibles that may meet an infected person and become exposed to the virus. After a certain incubation period, they become infectious, and therefore they can infect others susceptible. The infectious people in the standard model, either they recover or they become fatalities. In our model, instead, they can enter into 3 different loops, 3 different groups. Those with mild symptoms who recover and are done. Those with fatal symptoms and those with severe symptoms. The problem is that those with fatal symptoms and those with severe symptoms compete for ICU beds with a certain probability. And this is something that generates, differently than in the standard epidemiological model, in which the probability of death, the lethality rate of the virus, is fixed exogenously, it's a biological characteristics. And the R0 parameters just determine the time to which that is needed to get to that mortality. In our model, instead, the mortality is endogenous, because if there is an ICU constraint, not only those with the fatal will die, but also some of the severe symptoms will die. If there were no ICU constraint, all the fatal people would die, but the severe would recover. The severe would die only if there is a constraint. Now, this is our 19 by 19 matrix. So for example, this number here says that a 20 to 30 adult worker in the high risk group will infect 2.33 people in the 2030 low-risk active group, and so on and so forth. All these parameters have been calibrated in different ways, partly based on the evidence, for example, on the evidence of the different risk in the two sectors, partly based on the evidence on the risk by age, and partly with our assumptions. For example, the assumption that the very old are so much isolated that the risk is 0.5 under this policy is an assumption that we make. One thing on which we are working now, and is a big limitation of our result for the moment, is that we do not have a behavioral endogenous reaction of people to news. What we want to add in the next version of our model is the fact that people will change their behavior depending on the news. We see it in these days. Now that the virus seems to become less dangerous, many people go in the streets, they go to pubs, they drink, they like, they embrace each other. And this is an endogenous reaction to the news that we see. And so this is a limitation that we have so far. But using this matrix, we try to simulate and calibrate the fatalities that we have. And for example, this figure says that our model is capable to capture very well the differences between fatalities in the two regions, and the difference also in daily fatalities, which is more difficult. And this is thanks to the fact that the red line that measures the observed number of IC beds available in the two regions is a variable that is actually the only variable we could measure that actually allows us to capture well the differentiation in death among the two regions. And the reason why there are more deaths in Lombardy is that the demand for IC in Lombardy is higher than the supply, the red, and this causes more death. However, we are not so sure that although this IC constraint may very well explain what happened in March in these two regions, we are not so sure that this explains what will happen in the future. Because we think that this is a proxy of, this is what we can measure, but it's actually proxying something else. It's probably proxying stress of hospitals, proxying for lack of preparation of doctors in hospital. And we are not so sure now that in applying this model that is based on the past to the future would be correct. And we're working on this. So, as I said, we measure, we have these type of policies. We have four prototypical policies and then all the mixed policies. And when you apply them to the two regions, what you get is this result that I already mentioned. So now I have not total fatalities, but fatalities per million inhabitants on the vertical axis. And what you see is that the two regions have a fairly similar future if they want to stay below, if we want to limit GDP loss up to 5%, but to go beyond that point, the two regions would differ dramatically. And the reason why Veneto, surprisingly, would be worse off in the future is that while Lombardy has substantially increased the number of IC beds, Veneto has not done it because they didn't need to do it. Now, this is a prediction of our model that we are not sure about now. And we think instead that there is something else that explains the difference based on the organization of the health sector in the two regions. And so, although I'm showing this figure, in this moment, we're not so sure that this is really the good, it is good to explain the past, not necessarily good to explain the future. In the last few minutes, I would like to say a couple of words on schools. In general, I want to stress that this type of outcome, so the fact that we can reduce dramatically the economic loss without too many fatalities, is strictly based on the idea of sending back to work only those that have a very low risk of fatalities and of getting bad consequences from the virus. So young people in low risk sectors, and of course with no other health conditions that makes them at danger, okay? one question, one reason why I really wanted to have this interdisciplinary presentation is that I'm curious to hear from other disciplines why they think that this age criterion has been clearly rejected, not only by government, but the population itself. In Italy, when this proposal has been put forward by us and by a couple of others, there was really a total rejection, particularly by the old people, on the idea of letting only the young go back to production. Now, if you think about schools, this problem becomes even more evident. Schools in Italy are closed, and this is extremely costly in terms of human capital accumulation and in terms of equity, because we know that long distance teaching works well in well-off families that have many computers, that have rooms where their kids can study, they have parents that can help their kids deal with the computers and so on. But it is obvious that in many poor families, the last 3 months have been totally lost in terms of education of their children. Not only that, opening school is necessary if people have to go back to work. And the Italian government, as far as I can tell at the moment, is lost about what to do in September. Now, the problem is the reason why the technical health committee that is helping the government said that we should not open the school is that 59% of Italian teachers are older than 50. So if we open the schools now, we kill many of them. And this is why they didn't reopen the schools. Now, the obvious policy when you are in this condition is to reopen the schools with young teachers that will hold the kids in a classroom. And when an old teacher has to teach, in that case, it is more plausible and easier to have the old teacher teach in long distance. The schools will reopen with young teachers and all the kids. Old teachers will teach from home. Now, this figure tells you what will happen. The red dotted line is what will happen if we reopen the school with every teacher. The blue line is what will happen if we reopen the schools only with young teachers and we keep the old teachers at home. Now, to me, it is obvious that we should proceed in this way. So to conclude, continuation of lockdown is prohibitively costly. Prudent policy of gradual to work may save many lives with limited economic costs, as long as the threshold is not reached. You cannot go beyond the threshold because it would be too costly in both directions. But most importantly, disregarding differentiation by age and by sectors is crazy. The question for me, the interesting behavioral question and a question for social scientists is why this age criterion has been rejected. This is hard for me to understand. I don't know if there are lawyers in the audience. I've been told that there is a constitutional problem with this, but I don't understand why, given that we have many other criteria, many other things that are based on age, voting, pensions, military service. So why can't we do it in this way? So it's really hard to understand why age differentiation has been rejected. And if there is any comment on this, I would really appreciate it. Thank you very much.
Thank you, Andrea. I'm sure we'll have a lot of discussion of exactly that issue. But first, Vivien.
Hello, everybody. Delighted to be there, or rather not be there. Or no, I'm not delighted because I'm not there. Anyway, I'm in Boston, and I was supposed to be at the EUI today to give a talk on Europe's crisis of legitimacy, governing by rules and ruling by numbers in the Eurozone, which is the title of my new book that is out, will be out now in mid-June. In the interim, of course, I, as everyone else, has been looking at the Eurozone crisis, the pandemic, and asking myself questions. Eurozone crisis is over, presumably, but what lessons have we learned from the Eurozone crisis that can help us with the pandemic? And so this is a talk essentially on democratic legitimacy in the COVID-19 pandemic, what lessons from the Eurozone. And I thought I would do beginning with what I've learned from the book in terms of how do we define democratic legitimacy. And I'll use the Eurozone crisis in a tiny, very quick illustration, because I want to really spend most of this time on the COVID-19 crisis. So first, I'm going to talk about how to think about legitimacy in the pandemic, and then I will illustrate. I will first focus on the US relatively briefly, because I'm in the US and it provides a perfect example of many failures in different kinds of legitimacy. Then I move to the EU and the member states. So to begin, I suppose the big question is, how do we evaluate legitimacy? And ordinarily, people think of legitimacy in terms of governing authority. This is the Weberian, public consent, trust in government. And that's a very basic kind of legitimacy, and I certainly use that. But I think it's also important to add that another way of thinking about legitimacy is not just in terms of governing authority, but in terms of governing activities. This is about good outcomes, being responsive to citizens, governing accountably, transparently, inclusively, with efficacy, and of course the underlying features of justice, fairness, honesty, truthfulness, etc. So in terms of governing activities, and many of you are already familiar with this, in EU democratic theory, using systems theory, the terms that have traditionally been used are input and output legitimacy, so policy effectiveness and performance on the output legitimacy side, citizen participation and governors' responsiveness on the input legitimacy side, and more recently, but also others, have used the term throughput legitimacy, essentially to talk about procedural legitimacy. And here, I have 5 criteria that come under that. It's efficacy, accountability, transparency, openness, and inclusiveness. And I find it very useful to have throughput, because then you can ask, how do input and output relate to throughput and to one another? And this is actually the crux of the problem for many politicians, governors, and also theorists, is that there's often an assumption that there's a trade-off between input and output, and often an assumption that throughput as well. So in particular, in the case of the Eurozone, there's been an assumption that all you have to do is double down on the rules, procedural legitimacy, and you will get good outputs, performance legitimacy, and therefore it doesn't matter that there's no political legitimacy in terms of citizen input. In the Eurozone crisis, what we find, though, is that as the focus on doubling down on the rules, on procedural legitimacy, goes on, economic performance output deteriorates, and the political legitimacy becomes more and more toxic. But importantly, in the Eurozone crisis, what you see is EU leaders recognize the problem and change things by reinterpreting the rules by stealth, i.e., they do alter the procedural rules with increasing flexibility at the same time that they declare they're sticking to the rules. The result is output legitimacy, performance improves, but they lose procedural legitimacy, in particular on the accountability and transparency, but also in terms of the politics, the political legitimacy. So here one can talk about the Southern Europeans feeling oppressed, even though they're increasingly accommodated, and the Northern Europeans feeling deceived regardless. For EU actors, of course, one has to be more specific about the different ways in which they conceived of their own legitimacy and the way in which they dealt with the crisis. But that's it for the Eurozone. We now focus on the coronavirus response, and I will every now and again come back to the Eurozone in terms of the lessons. So first we start with coronavirus response in terms of governing authority. And here, trust, public consent. And what we know is there are mixed results. And a lot of the mix, and this is the connection between governing authority and governing activities, the better the governing activity, the more stable trust in government is, or even increases. And of course, as we know in the US, little trust in the federal government, either because Trump is in power, and that's the anti-Trumpers, or for the Trump's base, they're against the deep state. And at the sub-federal level, in the terms of the US states, what we see is a big differences depending upon which state we're talking about. High trust in terms of the coasts, in parts of the Midwest, but there's major polarization. In the EU, I think we can talk about a certain amount of trust, but of course the EU is not the focus here in terms of trust. When we talk about governing authority, it's really focused at the national level. And for Northern Europe, Merkel got up to 80% popularity. And clearly in Germany, there's an increase in trust in government. I think I want to wait to find out what happens in Sweden about trust in government. That's about performance issues. Italy, what we saw was a massive loss of trust in the European Union, but interestingly enough, increasing popularity for Conte, so for the government. In France, Macron only had a 4% bounce, which suggests that there was no increase in trust in government. And I guess the question is this about France's governing response, or is this simply France? We'll leave that aside. For Central and Eastern European countries, Orban, more trust, less trust? Again, this is to be investigated. And in the UK, interestingly enough, Boris Johnson gets sick and he gets a 20% bounce, but all of that is sliding now. And of course, we can't simply talk about trust in government, governing activity. Really need to look at governing authority. We need to look at governing activities. So first, what I'd like to do is define what that would mean in terms of the coronavirus. In terms of how can we think about these different kinds of legitimacy in the crisis in general terms, and then I'll illustrate with the US, the EU, and individual member states. So for throughput legitimacy or procedural legitimacy, here you have to ask about questions of, were countries prepared? What were their stocks of PPE? What about ventilators? We might talk about sort of in terms of efficacy or capacity, the reduced capacity of the state as a result of years of privatization and liberalization, and the neoliberal assumption that markets are better than the state. So this is Mariana Mazzucato calls this a difference between mission-driven governments, New Zealand, Vietnam, South Korea, versus countries beholden to the cult of efficiency and most enthralled to neoliberal governance. And here we're talking US and UK. But okay, that's a general comment on procedural legitimacy. Efficacy is about how quickly people respond and what they do, whether they put people in quarantine. The previous talk is a lot about efficacy in government in terms of legitimacy, whether they quarantine, when, is PPE available, testing for those who are falling ill, for those who are showing no symptoms, accountability. Accountability is important because it's about being held to account by a given forum, whether an expert forum or a political forum or the public more generally. And of course, in the pandemic, the problem is the parliaments are not meeting, or barely. Emergency powers has come out. And so the question becomes, who's checking for any kind of abuse? And what about experts in all of this as an expert forum? In some countries, they're ignored, sidelines. In others, sidelined. In others, they rule the day. Transparency. This is about truth-telling, information widely available and accurate. So statistics on testing, equipment availability, numbers of dead. Do you include the nursing home dead in the statistics? What about the numbers of collateral deaths? And of course, government communication, which is also linked to efficacy. How clear and consistent the message, as in wear masks, don't wear masks, you wear masks, I won't, this is Trump, etc. And then inclusiveness and openness, whether and how citizens are involved and consulted. How much consulting on the measures? Generally speaking, I think it's been very little. What about at the local level, consultations with local citizens? The big issue now is tracking devices on cell phones and issues of privacy. These are all part of that. So those were all throughput legitimacy. In terms of procedure legitimacy, output performance legitimacy is about policy effective and outcomes. How effective were the policies on health? How effective the policies on the restart of the economy? How much money put in, how effectively used, etc. And then of course, input legitimacy, political legitimacy, is about citizen participation, government's responsiveness to citizens, and whether you get respect for the tenets of liberal democracy, balance of powers, individual rights, freedom of the press, right to protest. And of course, here again, it's about emergency powers, little consultation with citizens. We have had populist protests against mask wearing in the name of freedom, civil liberties. So even here you can get conflict between different kinds of criteria for political legitimacy. Okay, so for the US, I think I'm going to go very quickly here. Efficacy, no efficacy. Battles in terms of the federal emergency response, the federal government battling with the states for equipment. I think this can be summed up in Jared Kushner's famous line, the notion of the federal stockpile was it's supposed to be our stockpile. It's not supposed to be the state's stockpiles that they then use. What? What? Congress votes $2 trillion in a CARES Act, which is massive. 2 months later, $500 billion given to the Treasury and Fed to distribute has not been spent. And of course, with Trump, mixed messages on the face masks, wear, don't wear, Lysol injections, what's that? Chloroquine, yeah, highly problematic. And of course, again, we're just talking efficacy here. There are big differences between the states and between states and cities. California, New York, different responses. Andrea, I'd like to see you do this model for the US as well in terms of different state responses. Both close, perhaps New York not quickly enough, but then you have Tennessee that doesn't close, and Georgia, they open too soon. So that's all efficacy. Accountability, Trump, the master of unaccountability. Is that only 5 minutes left? So I think I'll just skip the rest of the US, you've got the point. For the EU, procedural legitimacy. The EU is at first very slow to start, inefficacious. Initially, it's the Eurozone déjà vu all over again. The Council's unaccountable, it fails to act. As the member states pursue their own policies, the ECB claims that this is not in its mandate to deal with the spreads between German and Italian bonds. The European Parliament, no role. Commission, nowhere. And it's not just the Eurozone déjà vu all over again, but it's a migration crisis redux. National level borders go up, each country deals with its own issues, export bans, but this does change quickly. The member states throw out the Euro crisis budgetary austerity with massive infusions of money. The ECB, after its initial misstep, becomes the hero, as in the Eurozone crisis, without the ogre-like demands for austerity and structural reforms for countries. The Council this time around is not a dictatorship led by Germany as in the Eurozone crisis. There's a much more deliberative mutual accountability, although initially we have some problems. But the Council votes a massive package, then tells the finance ministers to come up with a project, who pass the ball to the Commission, who have just today come out with a proposal for a 750 billion euro fund. But of course, shades of the Eurozone crisis, we have the frugal four claiming that we're not going to, it's got to be strict conditionality, structural reform, etc. Completely Eurozone crisis. The Commission, unlike in the Eurozone, especially the first 2 years, they are not acting like ayatollahs of austerity, but rather very much ministers of moderation. They immediately suspend the budgetary criteria to allow unlimited government spending, suspend state aid rules, and one can go on. The member states, we can see great differentiation there too. I won't go into the differences, but in some there's vast incompetence, the UK and others not. But in terms of performance legitimacy, we can see that the ECB is the first responder with the PPEP. It's great, but there's going to be need for a lot more. There may be problems with the German Constitutional Court. We can talk about that later. The Council, again, already big question as to the results. The Commission, again, sure, the European Instrument for Temporary Support to Mitigate Unemployment Risks, great, but we also need unemployment, an unemployment fund, etc. And then finally, political legitimacy. And I suppose in the last minute left to me, I think here, this is really interesting. For populists out of power, they seem to have lost support. But for populists in power, some seem to have reinforced their support. I guess I should ask others of you in the room who know more about Central Eastern Europe, whether you see populist forces in government strengthened or not. And I think I should stop there.
I want to, as we enter the discussion, I'm not going to ask a question, but I'm going to say something that I hope will direct some of the questions to both of the speakers. And that is, it struck me that there was some degree of answer to Andrea's question that he posed at the end of what he had to say and what Vivien had to say. Because Andrea spoke of we, meaning the government, telling people whether they could work and who could work. And Vivien spoke of legitimacy, which is whether or not people's voices mattered. And these two things are quite at war with each other. So one of the issues to be addressed is when you say old people will not be allowed to work, who makes that decision? Is it Conte, is it Andrea Ichino, or is it the old person themselves? So this is part of the issue of legitimacy. So I'm going to not ask you to pursue that question now. I'm going to throw it open to the audience. I hope other people will follow up on this issue with more precise questions. So questions. I'm looking, if you want to ask a question, you should raise your little blue hand on your it says raise hand on the right-hand side panel under participants. I'm looking for raised hands. I see somebody called Sarsava raising their hand. So Sarsava, whoever that is.
Yeah, that's me, Sarah. I forgot to rename myself. Please reverse me back to some university shortening of my name. Thank you very much for the talks. Very interesting, both of them. I have two quick questions, one for each of you. To Andrea, I wanted to ask you if you have thought about differentiated policies by gender and whether that would make a difference, considering that especially the risk for hospitalization and intensive care is so much higher for men than for women. For Vivien, I had a question about legitimacy in relation to scientists and expertise. So I forgot a little bit in your model where that is placed. So whether you could comment on how you reason around if decisions are taken by scientists or civil servant experts versus politicians. It's been a big issue in Sweden, where I'm Swedish by nationality, where the decisions not to lock down, not to close schools, etc., have been taken by scientists and experts in the independent National Health Authority, and the politicians have been hiding behind this a little bit. So I wanted to hear your thoughts on that.
Okay, we would like to take a few more questions before we hear answers. I'm looking for more hands. I see Till Eichler. I see
Hello.
Elizabeth wanted to ask a question as well, but Till Eichler will go next, and then I believe Elizabeth will be after that, and then we'll take answers and have more questions. So,
Thank you
Till.
very much. I have a quick question for Vivien Schmidt. Thank you very much for the explanation. I was wondering whether you could shortly comment on a comparison. You were mentioning that in the Euro crisis, there was this idea of reinterpretation of the rules, but that actually led to suboptimal outcome because both sides didn't really take it as a positive development. The North were continuing to feel like, well, this is wrong, and the South didn't still felt oppressed. How would you comment on this Franco-German initiative right now, and clearly saying, for example, that it won't be credit, it will be like additional funding, which does not need to be paid back? Do you think that is different because it clearly deviates from a previous path, or do you think that there's a similar risk of being suboptimal taken by the population?
Okay, well, let's take a question. I believe Lisbeth had a question, so let's Lisbeth go, and then we'll listen to the answers of the two speakers. Lisbeth.
Thank you. Two really interesting presentations, so thank you so much. Andrea, you asked, why is there this irrationality, almost, or bounded rationality in terms of not thinking of by sector and by age? And I'm guessing you might want to talk to or relate to sociologists and psychologists on this. My sense is that, one of the things that strikes me in Italy in particular is the integration of older people into daily life. That is, it's very difficult to separate or segregate the older, more vulnerable people from the younger ones. And unless the government finds ways of reassuring some sort of return to normality after a transition period, or finds ways of minimizing the disruptive effect, the psychological and sociological disruptive effect of the rational solutions that you suggest, it may be very difficult to persuade the population. And I'm wondering whether this might be a way for you to go to kind of broaden to this kind of more sociological, psychological dimension. For Vivien, again, wonderful talk, and I admire your being so quick on your feet in terms of taking what you've learned from the Eurozone to the COVID crisis. There's one thing I'm not sure I agree with. And at one point you said it seems like the Commission's reaction has been a migration crisis redux reaction, and I'm thinking there's a big difference between the migration crisis and the health crisis, in the sense that health is not an EU competence. It's at most a marginal competence. That is, the European Union doesn't have the CDC. The total absence or incompetence of the federal government in the United States is unforgivable, given its competence in health, and particularly health crisis. But the EU doesn't have that. So in that respect, it seems natural that the default is the national government. And then in some ways, it seems to me, aside from the early pains of the lack of signaling solidarity by other countries and by the Commission towards Italy and Spain, that the European Union has learned fairly quickly. The European Union, both in terms of the Commission's response in taking action where it can be and coordinating where it can be, but those who are closer to the powers may just correct me on that. And the EU in terms of coordination among member states. After all, we're just 2-3 months into a very deep crisis, and we already have quite a bit of coordinated action on the table. So I wonder whether you can reflect a bit on the capacity of the European Union as a whole to learn from the obvious mistakes it made in the earlier crises.
I see Bridget's hand, but Bridget, can I ask you to wait till go first in the next round of questions? Bridget? No. Let's hear the answers then, and we'll hear from Bridget after the answers. So why don't we go in the same order as before? Why don't we have Andrea go first, and then Vivien go second, try to keep your answers relatively short because I'm sure we have more questions. But Andrea, you go.
Yes. So thanks. So first, by the idea of going by gender, well, first of all, it's not so clear the evidence. There is also a very important confounding factor, smoke. I know it for Italy for sure. Women smoke much less than men, and this might explain part of the differences. And also the differentiation by age and by sector. One important point is that we need to take care about what happens when those who go to work go back to home. And your idea of differentiation by gender would imply that men and women who have to separate also at home, that's a little bit more complicated. So that's why we didn't think about gender. And again, the evidence is not so clear. On the other question, let me put them together, the comment by David and the question by Lisbeth. So as an economist, I would think that a pandemic environment is a typical case in which there are a lot of externalities. And so if we let people decide, we get a better equilibrium. And therefore, we need some kind of coordination. And therefore, we need some kind of authority that guides the behavior of individuals. And that's why I was framing my presentation as the government has to do this, but it could be other kind of coordination instrument if they exist. But to me, it seems, but I'm happy to be convinced of the contrary, that we need some kind of coordination. Of course, there are economists who, like Cochrane, for example, who is into a campaign to say that the government doesn't have to do anything because individuals understand by themselves the cost, internalize the cost of the crisis, and they know very well what to do, and therefore there is nothing to be done, and people will react to the number of fatalities in the optimal way. The next version of our paper is actually going to test this by using mobility data. For the moment, I don't have an answer yet. I tend to think that this reaction is not there and that we need some kind of coordination. Thanks for the suggestion of going to the psychological literature. And yeah, I think it is really puzzling. For example, there are papers by economists that think that actually the older should prefer to stay at home and let the young work. In Italy, we saw the opposite. I'm not sure what is the explanation, but what is certainly the case is that if we send everybody back to work, this is very dangerous. So we need to find solution that differentiated between these groups. Otherwise, we're going to have a rebound for sure. So somehow these people have to realize that there are these differences.
I'm going to abuse my authority slightly here and ask Andrea a question which he can answer later. And that is, so is your belief that the reason old people should be kept at home and not allowed to work is because they'll go around infecting other people? Or is it because they'll get infected and die themselves? Because when you speak of externality, it makes quite a difference which of those two scenarios is true. Okay.
Yes, thank you very much for all these questions. I'm going to go in backwards order because I think that's from the more general to the specific. And Lisbeth, I think you may have misunderstood me because I was speaking possibly too quickly. But in fact, importantly, this is not the Eurozone crisis again. It was in the first moments, in the very first moments, that we all looked at this and thought, oh my God, here we go again. As individual member states close their borders, and where is the EU? That's the end of Schengen. And so that migration crisis sounds like. But it was mastered very quickly. And then in terms of the Eurozone crisis, there was the actions of the various EU actors. It was an initial moment of, we don't, we're not going to do anything, or we don't know what to do, or we don't have any capacity. But very quickly, the ECB truly was the hero. I mean, did learn the lessons, didn't take 2 years until we got Draghi's, we'll do whatever it takes. Didn't take 5 years until, oh, we better do some quantitative easing here. But immediately in a massive program. I think that's one. So the ECB is the hero, and without the ogre-like conditions, the Council, it's no longer the dictatorship led by Germany and its Northern European alliance, as in the Eurozone crisis. But it's much more a deliberative, sort of a mutually accountable deliberative body. In the book, I sort of try to ask, how can we talk about legitimacy for the Council? And although Council member state leaders present themselves as representative, and therefore this is a representative body, it's not. So the best you can do is say that within this body, there's got to be mutual accountability through deliberation. And I think what we've seen is actually that this time around. Much more deliberation. We'll see what happens with the Frugal Four, but I think this is already tremendously important. And the Commission really, from the very beginning, ministers of moderation, they are no longer ayatollahs of austerity, and they haven't been for a very long time. And very ambitious in terms of the proposals in the multi-annual financial framework, in this ambitious recovery fund. I guess the big question is, where is the European Parliament in all of this? Is it still just a talking shop, or will it become a potential equal partner? And I think this is important also for the political legitimacy aspects. But then to Till, in terms of the Franco-German initiative, I think this is tremendously important. This goes, again, back to the Council discussion that it looks like they're going to break out from the previous path. And this is about, I think what we can talk about, and this is about political leadership. And the big question with the Frugal Four, and I was just on a webinar yesterday in Vienna, but obviously in Boston, talking about what about the Frugal Four? And I said at the time, it seems to me it's a shocking irresponsibility on their part. And this has to do with performance legitimacy, with a lack of recognition that for Europe, this, just as with the Eurozone, but even more so here, it is the complete interdependence of European economies. And it's enlightened self-interest that they need to think about. Everyone is better off if Italian and Spanish industries also do better. This is about the EU as a level playing field. Germany has spent in state aid 51% of the overall amount, France 17%, Italy about 15%. But what you can see is, if there isn't a big fund, in terms of performance legitimacy, we're in deep trouble. For the divergences increase rather than decrease. And finally, for Sarah, in terms of Sweden, this is the big question about, does one follow experts? And the point is that it's still political leadership. It's political leaders deciding to not take responsibility in some ways and saying, no, the experts are responsible. And I've just got the figures on Sweden. Herd immunity, and so this is performance legitimacy or lack thereof. There's herd immunity because it's claimed to be a trusting society. There are 4,220 deaths compared to Denmark's 565 deaths. So, it's 418 per million versus Denmark's 98 per million. So here we can, at the very least, talk about performance legitimacy as in deep trouble for Sweden. Political legitimacy, I think that is for the people to decide. And as for procedural legitimacy, it's a toss-up. Who's accountable? Are the experts? Well, they're generally accountable to their expert forums. Political leaders are accountable to the public. And they're accountable procedurally to the public, but also politically. I'll stop there.
Okay, we'll take Bridget next, and then Moritz Weiss, and then Nicola Maggini. So Bridget, please.
Okay, Andrea, I really like your paper and that focus on age and intergenerational dynamics as the dog that didn't bark in the crisis. And I wonder whether there's a distinction between the acute phase of the crisis, where government power was used to tell us all we had to stay at home, we had to protect everyone, which in reality was protecting the old, and the recovery phase, where there is an opportunity to differentiate. But in order to differentiate, that you talked about a coordination power, which government or an equivalent, they really, a public authority would have to reframe the age issue. It would have to engage with society to explain that young people under 40 in Europe have had the Great Recession and now COVID-19, the scarring effects, labor market effects on them are much more serious than for older people. So without a reframing, you can't simply change the policy. It would really require an engagement with the society to legitimize this. And I think it would have to be on the basis of intergenerational fairness and equity. But I'm surprised across Europe that governments are not attempting to do this. Is that fear of older voters? Older people vote in larger numbers? Or is it something to do with the intergenerational bargain in our society? In other words, it's more sociological than political. So I'm simply responding to your paper. I think it's a really important question that you're posing, that whole age dynamic, and I would encourage it. Vivien, if I could take you beyond legitimacy, COVID-19 has been a significant display of public power, both on the coercive side, you stay at home, but also on pump priming, maintaining health and welfare systems. Is this episodic, or are we witnessing a state market rebalancing for the next period?
Okay, we're going to continue with two more questions. Philip and Kateg, I see both of you, but you'll go in the next round. Next is Moritz Weiss.
Thank you very much, David. I just want to be brief. Thank you very much, Andrea. I have a follow-on, I think, from Bridget on your presentation. Two issues. I think the first is that the whole age issue is something that we only learned over the crisis. So I think it is just a question why they do not respond to this finding, or why they do not discriminate now with their policies. And there, to be very honest, like it's, and that's more maybe like an impression, it's just they stick to the general rule of reducing contacts, I think, because it is politically convenient. It is a very cheap measure. The people do not, like, it's a very indirect measure. I think in the end, it's a very costly measure, as you also indicate. But immediately, it is very indirect. The people do not see it. And that could be one of those explanations why they choose such a irrational policy to some extent. And I would be curious to hear your comment on that. Thank you very much.
Okay, we take one more question this round, and that will be Nicola Maggini. Nicola?
Yes, I want to do a question regarding the paper presented by Andrea Ichino. And my question is very similar to that of Moritz and Lisbeth Cook. Indeed, in my research, I'm focused on political attitudes and behavior of young peoples, but from a sociological standpoint, we know that, for instance, in Italy, relationships, social relationships across generations are huge. So it is very hard to isolate people over 50 in Italy, because we know, for example, that many young people in Italy live with their parents until 30. So it is difficult to isolate these people, and this comes about also as regards high school. And we know that, given our social structure and welfare regime, we know that grandparents usually take care of grandchildren in Italy. So it is just to say that it is not so easy to isolate age groups. Furthermore, I think that this is an interesting proposal for this phase. In other words, when we are not in a peak, during the peak of the pandemic. Because if you are in a peak, during the peak of the pandemic, even if you isolate only those over 65, those over 50 years old, the problem is that the virus, the spread of the virus could be high, and we are not very sure that, and this entails that even many people under 65 could face the risk to end up in ICU units. Of course, maybe they do not die, but this is a risk anyway. And so I think that it could be reasonable to think about it, but if you are not during the peak, and furthermore, if you are able to really isolate. We know that in Italy we have 18 million people over 65. So it is not so easy to isolate these people who have a strong social relationship. Just this.
Okay. Nicola, can I remind you to lower your hand now that you've asked your question? Okay. Again, we'll go in order. Andrea, you go first, and then Vivien will go next. So Andrea.
So first, your remark before the end of the previous round. If you put a group of old people and a group of young people in the same subway or in the same movie theater, they infect each other at the same rate. So the R0 is the same for that interaction within that group of people. So the reason to stop people or to coordinate is not the rate at which people infect other people differently by age for given type of interaction. The problem is the consequences of the infection. So in that subway, if the young get infected at the same rate as the old, the young don't suffer, the old suffer a lot. So the question is whether we want to at least suggest to the old that maybe it's not a good idea to go on the same subway with the young. Which leads to the other questions that I've been asked. Let me group them together and answer first the question about peak versus phase 2. Obviously, there is a difference. I think nobody, although we started to suggest the age of option already in March, but nobody would have suggested that it would have been a good idea to start immediately at the peak with this differentiation. Also because, as someone said, we were not so sure at that moment that the young were not hit severely. There were still doubts, but now this is evident. As I said, 30,000 people died in Italy, only 300 below 50 years of age. So now we know it. So the question is, now that is, we are no longer at the peak, that is, we have to think about other ideas. Now, if the objection is that it is difficult from an organizational point of view, I see the point. It is difficult, but not impossible. Certainly, it must be less costly than 50,000 fatalities or a 25% loss of GDP. We have to remember that the loss of GDP that we are encountering because of these 2 months of lockdown is already huge. If there is a rebound in October, we are in deep trouble economically. So you can tell me that it is difficult to separate the old and the young in Italy, but it is doable until the vaccine arrives. For 1 year, we will take turns going to movie theater. For example, something that surprises me is why in Italy, supermarkets don't organize turns according to age. The old go in the morning, the young go in the afternoon. Why can't we have separation in movie theater? Why can't we have separation in subways, in transportation? There is a bus for the old, a bus for the young. I know that this is costly, but don't tell me that it is less costly to have a 25% GDP loss. Or 50,000 fatalities in Lombardia. So yes, it is difficult, but it can be done. It's just a matter of thinking about organizational solution. By the way, if the young get infected, is also useful for herd immunity. We also have a huge touristic sector, hotels. Think about Florence, how many hotels are empty and in trouble. For a while, we could put the old or the young in these hotels. And this would allow those who come home not to infect a different generation. So there are solutions. It's just a matter of thinking about whether we want to try to find the solution or go to the risk of having an enormous amount of fatalities or a huge GDP loss.
You're such an American, Andrea. Okay, Vivien, your turn.
Yeah, so before I answer Bridget's question, which is a really important one, I just want to ask Andrea a question, which is who decides and how? And that is, you know, in terms of, it seems to me that you're saying it's a technical decision and the politicians would take it based on the experts. But my question would be, could you have differentiation in terms of local, regional, and have it deliberative forums so that, because it's not only that different areas have had different experiences and different problems, and this is not just Italy, but everywhere. But it's also that we've talked about before that the people, quote unquote, are gone from all of this. And if you want to sustain a kind of appropriate response, then you have to bring the people on board. And it's not enough just for the political leaders top down to say, you do this, you do this, you do this. At some point, there needs to be much more bottom up kinds of discussions. And it could be in the form of deliberative assemblies, you know, sort of the deliberative democracy group could get in here and give all sorts of advice on how to do this. But I think it's important to ask, to what extent can you decentralize the decision-making in terms of geographically, in terms of levels of organized units, of political units, and to what extent can you shift the decisions to the people, you know, sort of citizens in different localities, as opposed to constantly making it sort of a top-down. So that's my question for you. Now, in response to Bridget's really important question, and I suppose this sort of whether there can be a state market rebalancing. And for me, I would fit this under political economic outcomes or output legitimacy. And the big question, and we don't know as yet, is this going to be another lost opportunity? Is this going to be the resilience of neoliberalism in the European economy and the global economy? Or are we going to see a change? I think what you see with the Frugal Four is, oh my God, there's going to be tremendous debt. We can't have debt. Those are the old ideas. But it seems to me that we need a rethinking of economics. Take Danny Roderick's proposals for new managed globalization. It seems to me that that is necessary in a rethinking of international institutions. We're at a point where there's going to be massive state involvement in the economy for a very long time. The question is how that can be used effectively. We're going to see global supply chains really become less and less global. You can also see that in terms of the US manufacturers pull back from China, not simply because of Trump, but more generally because of the problems of the pandemic. You can see in France and everywhere else a sort of a recognition, oh my God, we've completely deindustrialized, we need to reindustrialize. So that I think that there is some rebalancing already going on. So if a recognition is we've got to do more on the industrial side at the national level, you know, and forget these global supply chains where the only people who have masks and ventilators are in China and they're using it for themselves. But beyond that, then the question that entails a whole range of other things, which is then if perhaps we need to remake the rules, which would allow capital controls. sort of tame the financial markets. So no more great, not as much capital mobility that then hurts countries, developing countries in particular, as the money is pulled out. Protect infant industries, that will be necessary as well, if only in the health sector. And in terms of trade, now we have to shift. It's not just that the global supply chains are going to be lower, but we need to recognize that the current trade regimes create too many losers with massive inequality between the winners and the losers. What does that mean in terms of if we're shifting from service industries back to some manufacturing? If we're bailing out industries, what about nationalizing them? What are the limits that we're going to put on the banks that we didn't do before, or the limits on industry? I noted, I think is significant is the fact that Germany is bailing out Lufthansa, but in exchange is taking a 20%, or has asked for a 20% share in Germany renationalizing, partially renationalizing. But these are ways in which I think we're already beginning to see a rebalancing between state and the market. So it just becomes a question of how much. And then in terms of salaries, nurses, grocery store workers, who are the essential workers in the crisis who are paid nothing. All of that, I think, requires massive reevaluation. Whether it'll happen or not, don't know.
Okay, we're very short on time now. We have 4 hands raised, so I'm going to be pretty strict. I'm going to let all 4 people ask 4 questions. I'll give you each 1 minute only, and then that will leave each of the speakers 3 minutes to respond. So we'll go through this in order. Philip Hansbach, you're next. You have 1 minute to ask your question.
Thank you very much. I'll be straight to the point with a question for Andrea, and I want to know how you deal with per capita data. You started with data from 2 Italian regions that you put in perspective to the relative size of the populations. So my question is, how would you expect cases to scale linearly with population size? If yes, why? And if not, should a good predictive model also consider settlement structure and urbanization to help you predict the model in different circumstances? Thank you.
Thank you. Okay, Katge, 1 minute.
Thank you very much. It's Catherine. Thank you to Andrea and Vivien both for your papers. Andrea, have you looked at comparison with other countries? I don't know how relevant it is, but for example, I know that in the UK, there was a problem with very young people and the disease, the Hashimoto. Also in Brazil, they say there's a lot of younger people who get the virus and the reason there they say is because actually old people stay at home, young people don't. So is it a given that if in Italy old people do stay at home, actually young people wouldn't get it? So if you compare with international data. Vivien, I really like your 5 categories, and I was wondering if you look at them changing over time. Because of course, if you think of the procedural legitimacy, that was what came up. You need
to really enforce the time rules here. You have 20 seconds.
Yeah, I'm finishing. So if you look at the procedural legitimacy that was at the beginning, but for example, wouldn't it be today accountability with number of deaths? I don't know if you had that, sorry, in efficacy, number of deaths.
Okay, Federica, you're next, 1 minute.
Yes, just one question to Andrea. You mentioned that you would like to have in the next version of the paper the possibility to have the effect of news over the decision and on the ways in which the change will be decided. And I was wondering how you will introduce this element, because this could be recursive in the beginning of the analysis, because this was exactly useful because you will see how the changes will occur in the spread of the pandemic, but not. I was wondering how do you use that in the next version? Thanks.
Thank you. Last question, Claudia, please.
Thank you very much. I have a very quick question for Vivien. So the coronavirus crisis has pushed governments across the entire world to take liberal measures to contain the spread of the virus. Given the urgent need to contain the infections, there was limited scope for holding public consultations, and so limited scope for inclusiveness. So if we look at the number of victims from Central and Eastern European countries, one could argue that the liberal measures have been more effective in liberal democracies, such as that of Viktor Orban. So what can the EU do to prevent the current liberal measures from transforming into an indefinite or even permanent power grab by illiberal politicians? Thank you.
Thank you. Okay, Andrea, you have 3 minutes to respond, and then Vivien, you'll have 3 minutes. Andrea? 3 minutes.
Yeah. Vivien, thanks. Your question is very important. And so let me answer in this way. Why do we have speed limits on highways? Why do we have street lights and safety belts? We have them because the state thinks that there is a coordination problem and there is an externality due to the fact that if people don't put safety belts, then we have to treat them, and this is problematic. And at street lights, we cannot have a deliberative assembly every time people meet at the street light to decide who goes first and who goes second. So here is exactly the same problem, I think. We have a problem of coordination. We have a problem of externalities. I don't think it is possible to have a deliberative decision given the urgency of this problem. And given the fact that we're not talking about something that hopefully should last forever, but we're talking about a transition period. I should also mention that nobody in February would have thought that we would have accepted this limitation of freedom of movement as we had in the lockdown everywhere in the world. And we did it. So can't we accept some more limited dimension of this limitation in the sense of limitation in the interaction between old and young? And last point on this, fine for me not to impose safety belts, fine for me not to impose street lights, but then we don't have to complain if there are deaths. So if people don't want to follow this prescription, it's fine, but then we will have to accept fatalities. The cost of locking down the economy is huge, and we will feel it very soon. So that's the problem. So the question about other countries, in this moment, no, we prefer to focus on what we can measure more precisely, but it is extremely interesting. And actually, one of the problems that we are facing now on this emphasis that we put on the SE constraint is that it doesn't seem to matter for the US, for example. So there must be something else that we are not capturing about the health systems. But in terms of young getting the virus, that's again, is not a problem. The virus, the young get the virus, but they do not get the consequences of the virus as much as the old. And so this is the important difference. And as far as I can tell, this is true in Italy, but it's true also in other countries. I may be wrong, but we can talk about it later. Endogenous reactions, the plan is the following. We want to estimate with the data on mobility that you can get from Google's from many ways on how much people move, how much phones move around the country, and to regress the movement on the news, and in particular the fatalities, and then use that parameter to endogenize the R parameter in the simulation for the future. So if one standard deviation more death reduces mobility by half a standard deviation, then in our simulation, when there is an increase of standard deviation, there would be a reduction of R. And this is how to, in a very brief way, to say how we will do it. Last, and then I'm done, geography. This was a question also before that I didn't answer. Yeah, again, we can allow choices, regions to act differently, but then the cost is, as we are experiencing now in Italy, is that southern regions don't want to let us go on vacation in the south because we in the north are at higher risk. So when we allow regions to decide and local communities to decide, that would be the end of a country in some sense. So this is why if we still want to have a central government, the government should do its job.
Thank you, Andrea. Andrea took 4 minutes, Vivien, so in fairness, you may also have 4 minutes.
I'm really sorry.
That's great. So I guess the first question was about efficacy and then number of deaths. And what I'd like to do is say that when you talk about efficacy, it's the kind of measures that are taken, and that's part of the procedural legitimacy. But then if you're actually looking at the deaths, that's about testing the efficacy by looking at their effectiveness. So it's policy efficacy of procedures, effectiveness of policies. And if we look at the effectiveness of policies, I think Andrea would agree with this, but that the faster the closures, the sooner the closing of everything, the better. And the later the opening, you see fewer, and of course there are big differences amongst countries, and here you have to take into account also the background factors like what's the capacity of the hospitals, who knew early enough, and obviously Italy was caught not knowing as the spread was tremendously, was going on and on and on, but the UK certainly knew it was spreading, and yet, and the US even worse, basically denied. So that's where you can talk about, we can see the lack of accountability, the lack of transparency, the lack of testing that has also led to, problems with effectiveness. And I think that's, that's clear. And what's nice about using these various ways of thinking about legitimacy is to recognize that they're all interactive, but that one can distinguish amongst them. And so it's very helpful analytically. But then on the next question from Claudia on illiberal measures, and in particular in Central and Eastern European countries, I think this is a tremendously important question. But it's important also to recognize that all countries have had to engage in emergency procedures. So in a way, all countries have suspended the rules of liberal democracy. But in the interests of so it's essentially diminishing political legitimacy or suspending political legitimacy in the interest of performance legitimacy, in the interest of effectiveness. It's, in a way, it's emergency powers, and there's a literature on this, Jonathan White and others. It's, are you using your emergency powers to solve problems, to make, in the public interest, to make things better, or are you engaged in emergency exploitation? And I think the problem with the Central and Eastern European countries is there's a lot of, part of it is to solve the public interest problem, but there's also a lot of crisis exploitation. This is about illiberalism coming to the fore, certainly Orban, but also Kaczynski, the sort of all the abortion, and this is also in the US in certain states like Texas. Basically, this is a wonderful opportunity to say abortion is elective surgery, therefore we're not allowing it. So that, it's important to distinguish that. It's also important to recognize that, yes, the Central and Eastern European, so this is on performance legitimacy, yes, the Central and Eastern European countries shut down very quickly because they have fragile health systems. They didn't want too many people in the, in the emergency rooms at the same time, don't have the number of beds, and they shut down, and therefore they were effective. But Portugal also did this. Greece also did this, and also have had effective policies. They shut down early because they have fragile systems, and they have not had they had very, very, very comparatively few cases, in contrast to Spain, and Italy, and France. So I think that's important to see. So it's not simply, yes, everyone's using emergency powers, but to what end, with what effect?
Okay, thank you. We'll see you all next fall, hopefully in person and not in Zoom, and some of you before that. Thanks, everybody.
Thank you all.
Bye-bye. Thank you.
Bye. Bye, thanks.
Bye.
Bye.
Bye.